All right. Good afternoon. Welcome to Measles 101 and 10. I'll wait for a few others to join in before we get started. Okay. So, good afternoon. My name is Brianna Blakemore. I am a public health investigator supervisor with the Outbreak Management Unit here at the Health Department within our Public Health Science and Surveillance Division. So today I'm going to speak a little bit about measles and how the outbreak management unit within the health department is working to mitigate measles in the city of Houston. So currently, the outbreak management unit is supporting our Bureau of Epidemiology department and helping do surveillance investigations for measles cases that we are having reported. So with that, we reach out to anyone who was potentially exposed to measles cases. We review their immunity status. We go over their level of exposure, and our investigators complete a series of questions to just ensure that they are aware of what type of resources they have available to them and any recommendations that we can provide. So with that, we identify whether or not these contacts are high risk or low risk, depending on their exposure. We identify whether or not their risk status are with children that are less than 12 months, whether they are immunocompromised, whether they are pregnant. So what we do is we follow the CDC guidelines in addition to resources that have been provided to us regarding measles. We also assist with identifying your immunity status by, good afternoon, by recommending you to your PCP to identify, any vaccination records that you may have for MMR. Currently, our department is also supporting initiatives with vaccination clinics that we have throughout the Harris County area. For more information on that, you can go to our website at houstonhealth.org. So with that, we also do a sense of contact tracing. So once we identify that you may have potentially been exposed to a measles case, we do a series of contact tracing by identifying, like I said, your immunity, your date of vaccination, any potential risk factors you may have, the exposure information, and collecting any necessary patient information from your 21-day window of monitoring. So we also do go into the field if necessary. So investigators will reach out to those who have potentially been exposed, as well as cases if necessary. And if we are unable to make that initial contact with the exposed persons, we will go out in the field and reach out to those persons via like confidential mail per se, just to let you guys know, like, hey, we're trying to get in touch with you. So if you do receive any notifications or communications from the Houston Health Department, just know that we are here to assist you in the best way possible. So if you get any of those types of communications, please be sure to follow up with the identified information that has been provided to you. So our unit as a whole, as an outbreak management unit, is to help stop the spread of any potential outbreaks or clusters within the city of Houston. And so, to answer the question, going into all of our Houston communities and taking a census on the infection rate, my unit in particular, we do not get a specific census on the infection rate. However, we do track information overall based on what has been reported to us. So with the information that we receive for reported cases, we are able to assess like where the needs are within the city of Houston and how we can address those things. We also continue to provide resources to the community through our website of houstonhealth.org. I hope that answers your question. So also in regards to measles, I know we have previously had questions on how to identify, no problem, on how to identify signs and symptoms relative to measles. If you do feel that you are potentially experiencing signs and symptoms, we have a list that has also been a necessary resource for the community on our website, but also you can consult with your PCP to follow up with you, and you guys can probably set up a telehealth appointment just to ensure the safety of both you and your primary care physician, and then they will guide you with the necessary steps on what to do next. So as a department, we are continuing to monitor measles and the spread of measles as it comes. We are doing our best work in supporting each other and supporting the community with our efforts. With that, we will continue to produce more resources and information as it's provided to us. So we are also providing the necessary and accurate information to the community as soon as possible. Okay. So when we go out into the community, so my unit in particular, the outbreak management unit, it's dependent on the severity of the situation and the details of the situation. But if we're speaking relative to measles, if we go out into the community, it's specifically to provide some communication to those that may have been potentially exposed, just so that we can communicate with them, give them the information that they need to follow up with next steps, and so we can provide them the necessary guidance relative to their exposure. Okay. Well, that has been Measles 101 in 10. Thank you all for your questions.